everyone. Sorry, my Huai is not very good, so we do this in English. All right, we'll start today and we'll talk a little bit about genetic testing. I'm a neurologist, so I do see TTR patients, but the main topic today is about genetic testing in TTR amyloidosis, okay? So I thought I'd quickly tell you a little bit about genes and how TTR amyloidosis is inherited, so you can figure out how it's passed on in families, and also what we do in a genetic counseling session. Okay, if you think about genes, they're sort of like an instruction manual for everyone. And basically, we have about 20,000 genes in our body. Science today has understood about what 7,000 of them do. So if you can imagine, if a gene is an instruction booklet, it actually gives the instructions to form something called an RNA, which then eventually forms a protein. And along the way in the instruction manual, if some of the instructions are faulty, then the eventual protein that's produced is also faulty, okay? So when we talk about genes and how they cause diseases, it's actually because the instruction manual, somewhere along the way, the signal doesn't go well, okay? And so when we talk about TTR amyloidosis specifically, it's usually inherited in what we call an autosomal dominant manner, okay? That's a lot of scientific talk. Let me break it down for you simply. We all have 2 copies of every single gene. We get 1 copy from mom and we get 1 copy from dad. When you have 2 copies of every gene, some diseases manifest themselves as long as you have 1 abnormal copy. And that is how TTR works. Okay, so TTR amyloidosis, if you have 1 abnormal copy of the gene, that's enough for you to manifest the disease. Okay, so in this particular example, you can see I have put the father as being the affected one, and he has a yellow big D, which is the affected gene. So when he is to have a child, there are 4 options of what could happen, of combinations with mom and dad. And 50% of the time, the child is more likely to get the affected gene. So if you do have TTR amyloidosis, there's a 50% chance that your children may have it. Okay? Similarly, your siblings are at a 50% chance of having it. Okay, what we do in the session is try to explain how diseases are passed on from generation to generation. We also try to explain how the testing works. I think there's some questions in the chat group about costs, etc. What the insurance implications, what the implications for your employment, what the implications of planning a pregnancy. So we go through all these different aspects when we're doing genetic counseling. And there's many things we talk about. We talk about treatments, we talk about options of testing, we talk about whether you want to test during clinical testing, which is costs involved, or whether you want to do it under research so you have an idea, but everything is actually off the system. So there's a whole bunch of things that we actually talk about, including the option to withdraw at any point in time. And that's what we do in the session. So that also means that session isn't a regular 10-minute doctor consult. It's about a 30 to 40-minute session where we talk to you and the entire family to try to figure out what the probability you have this disease is and what your options are in terms of testing. Okay? When you do the tests, there are some possible outcomes that you can have. The first thing is a clear-cut yes, which means that you go in thinking you have a nerve or a heart problem, you undergo the testing, and the answer is yes. You have TTR amyloidosis, or yes, you have another condition that's inheritable, okay? And then we talk about what the implications are. What are the treatment options? What's the risk to your children? What's the risk to your siblings, okay? There's also some other complicated things that can happen, which is that you could get a no answer or an unknown answer. And I think the unknown answer is the thing that's a little bit scary for people here. And the reality of the situation is that genetic testing is a new thing. It's now much more common, and a lot of the times the reference that we're comparing things to is a Angmo reference. And because it's an Angmo reference, sometimes when we see new things, we're not so sure, is it actually causing the problem? Or is it just a difference between a Chinese gene and a Angmo gene? So we do have to do further tests. So there are some times that we get back an unknown or intermediate result, or we can get a negative result. That's also possible. So when we meet you after the genetic testing, we do go through all the results, the options, what we think is happening. Do we think it's actually a positive, but just because there's a difference between Angmo genes and Chinese genes, we're not actually getting enough data to say it's a clear-cut positive, or do we think that it's a negative and we have to look at other options? So we do have a specialized genetics clinic that we go through all of this with, and usually it's a long consult, so it's usually 30, 40 minutes per session, okay? And a lot of people may wonder why we go ahead with genetic testing. When I started testing for TTR amyloidosis in 2019 or 2020, the answer I was telling people was there's no treatment available. Very quickly now, there now is treatment available, and we're involved in gene therapy trials with the WHO and other members. So science is also progressing at quite a rapid rate. And things that don't have cures or treatments in the past now suddenly do. And even if there is no cure, because 50% of the time if you have a child that you have a risk of passing this disease on, there's also the option of how we can do family planning. Do we want to do an IVF pregnancy to make sure TTR doesn't get passed down to the next generation? If you're already pregnant, do you want to do while you're pregnant, some sampling to see whether the baby has this TTR condition? These are all options we can discuss and options that are available medically now. And so these are some reasons why, even if you don't have symptoms, it may be useful to test, because a lot of the time the TTR symptoms comes up in your 40s, your 50s. But if you're the child of someone with TTR amyloidosis, you may still want to know, because you may want to prevent it from going to the next generation. Okay, that's about it for me.